honorable leaders, distinguished guests, dear media friends, ladies and gentlemen, good afternoon. First of all, please allow me to extend our warmest welcome and sincerest gratitude to all of you for joining us this afternoon for the seminar on public health. And now let me invite our distinguished speakers to come to the stage. Be seated, please. Mr. Pakunta, yeah. Ms. Calypso, our Marianne. And we have our moderator, the best moderator, DG Rodrigo, on the stage as well. Please welcome Mr. Hong Kim, Director General of the Social Infrastructure Department, to preside over the opening session. Over to you, DG.
Thank you, Zhao Jing, very much. Thank you really very much. And also, I really have to say, apologize for this delay. But actually, initially, I thought we can only start 3 p.m. Our situation 15 minutes ago, it appeared that if we could start 3 p.m., we are lucky. But, oh my God, we can start before 2:30. So, that is partly excuse, but situation was quite hectic here. So I'm glad, and our speakers are all here, and we are here, audience is here. So, on the other hand, we have more freedom in terms of controlling our time. So I don't think Zhao Jing will do too much of time control. Okay, so having said that, once again, as Zhao Jing said, we would like to welcome everyone to join this session, important session, as a speaker and also as an audience. And my name is, once again, my name is Hoon Kim. I am Director General of Social Infrastructure Department at AIIB. AIIB is physical hard infrastructure bank originally, but now the social infrastructure's importance, the AIIB has a social infrastructure department. And it is an honor for me to welcome you as the AIIB now reconvene in person for the first time in 3 years. Our last annual meeting was in, I understand, Luxembourg, when social infra didn't exist. So the first meeting for social infrastructure, AIIB, now is in Egypt. And our theme for this important conversation this afternoon will be about the partnership, forging partnership for global health infrastructure for tomorrow. And my job in this introductory session is twofold. One is to set the agenda for the panel discussion, and the other one is to introduce our distinguished panel members. Now, COVID-19, we have to talk about COVID-19 whenever we talk about health, right? So COVID-19 affected every facet of our lives and exposed the fragility of our health systems. We can say by now it is behind us. And we all agree that it is time to build a resilient and efficient health systems that are prepared for the challenges of today and also tomorrow. So our focus today is therefore identifying some of the most pertinent challenges facing member countries in the aftermath of the pandemic and laying a roadmap for amplifying the efficiency and impact of these initiatives through stronger international collaboration. So a key area of focus in our panel discussion today will be therefore health partnership models in accelerating the universal health coverage agenda, particularly in low and middle income countries, in the wake of COVID-19. And while considerable progress has been made to expand equity and quality health services, formidable challenges still remain. And these challenges have been exacerbated by the pandemic, and which has not only put tremendous pressure on the health system itself, but also diverted our limited resources away from the long-term infrastructure investment. So the unexpected challenges of the pandemic forced government across the world to divert substantial resources to the emergency short-term response measures. So therefore, now is the time. There is an emerging and undeniable need to shift, mobilize resources back to the long-term investment to ensure the resilience and sustainability of the health system for the future. Might be observing already, some of the governments might have forgotten already our COVID-19, the pain we had, and maybe their focus is already shifting from health. Public finance is under extreme stress, and maybe the attention is being diluted. One actually, the exception I would say, what I saw is in Indonesia. Government actually is really committed and mobilizing tremendous resources in filling the gap in the health system, which in my many experience in development bank experience, I never saw such a commitment of the government. And having said that, so we know from COVID experience, we know we know our system, we've been working on the system, but COVID-19 has exposed what is the gap is there, right? And also how we will reorient our battle with our original target of fighting or bringing UHC. So I'm sure WHO is on top of it, and all of us will be part of it, but where it will go and how each of us will contribute in this process, I think that should be the main exchange in this discussion. So because you represent, each of you represent very important stakeholder and resource provider in the global health architecture. Now, having said that, today's moderator is my colleague, Mr. Rodrigo Salvador, because I mentioned earlier the focus is partnership models. And he's the DG of Internet Partnership Department, Operational Partnership Department, so he's the right person. He knows how to bring partnership. He's an expert, so he will lead the panel discussion with 4 distinguished panel members. And I mentioned the government of Indonesia, and Mr. Kunta Wiwaba is Secretary General of the Ministry of Health of Indonesia. And he has a comprehensive responsibility of coordinating the implementation of the ministry's tasks and activities, and he is guiding and providing administrative support to all organizations and units within the Ministry of Health. And Pak Kunta had a distinguished career in his long service in the government, in the Ministry of Finance, before joining the Health Ministry. And he has PhD in public finance. And alphabetically, the resource people, the Miss Calypso Chalkido is the founding head of health finance at the Global Fund based in Geneva. And she is also a visiting professor of Global Health at the School of Public Health, Imperial College, London. And her past work has concentrated on helping governments build technical and institutional capacity for using evidence to inform health policy as they move towards universal health coverage. She holds a doctorate in molecular biology. All of our speakers are doctor or PhD, so I will not use that doctor title anymore. And the next, Mr. Obo Kakikonen is head of representation to China and Mongolia at the European Investment Bank, and he is also the minister counselor at the delegation of the European Union. And his current role involves coordinating the activities and policy objectives of AIIB within the region in close collaboration with EU delegation and the local authorities. In his earlier career, I remember when we talked, you also served as a medical officer in WHO, and you have a passion in health. Yeah. And Miss Marianne Saraka Yao is, what can I say, very big hand. And she is the Chief Resource Mobilization and Growth Officer at Gavi, the Vaccine Alliance. We know the reputation or role of Gavi during the pandemic period. And since 2011, her leadership has played a pivotal role in propelling Gavi's strategic growth and raising crucial resources to ensure equitable vaccine access for all. I said big hand because under her stewardship, over $33 billion has been raised from 60 donor government, foundations, corporations, organizations, and resulting in the immunization of more than 1 billion children and supporting the COVID-19 pandemic response. And she holds an MBA and master's in economics. Now, with this, I would like to hand over to Rodrigo to start a real interesting discussion this afternoon. Look forward to your performance.
Thank you. Do you hear me there? Yeah? Okay, so thank you so much, Hun. I think, it's an enormous pleasure to be moderating this panel with some very good friends. We have in a former life, I was at the Gates Foundation for a long time. So with that, I have the pleasure of working very closely with Marianne and Calypso, right, including on the COVID wars, right? Very humble to have the secretary, also Kunta, with us. I think, in many of these things, we always miss, or we often miss, the country perspective, right? So we always try to tell countries how to do their things, and there is no one represented there. So I think the fact that we have it is great. And also, Albo, it's great to have there's so much focus on the NDBs these days, right, that actually we need to say something, right? And we need to say what we're going to do. So, again, this is a super rich panel. So my sense is that we can start like this on, how much time do we have, by the way? Okay, excellent. So I would say three things, right? The first one is, defining the problem, right? Like the scene setting, where are we right now, right? So I would like each of you to actually give us, from the different perspectives, what are the main challenges? We are coming out of COVID. We thought that, but this is still there, right? And the transition, and then now is all these sort of triple transitions, right? Climate, digital, health, social, right? Many things that are piling up, like debt. So you all have very different vantage points on what you're doing. So I would love you to first start with, again, where we are. Then we should be moving into where the architecture and what actually needs, what are the key gaps, right, that we need to do. And then we can land with the sort of partnership, the sort of solution setting, right, like a solution set. So So starting perhaps with you, Secretary, on what are the key issues right now that are in public health, right? I mean, again, when you are struggling with coming from COVID, you see like the future. What are the key gaps that you see in global public health in your mind? And what are the gaps also, if you have, in terms of the architecture and how they should be supporting you, right, from your perspective?
Okay, thank you. Thank you, Rodrigo. So, what is Indonesian position right now? Actually, like Hukim said, the COVID-19 is become a challenge for us. Yes. So we know that we have a lot of gap, but not only we want to solve our gap, but also we need to thinking about the future. Right now, you know that after we are facing the COVID-19 pandemic situation, Indonesia will have a privilege known as the demographic bonus, which should be utilized effectively, of course. It is estimated that there will be 68% of the entire population, or 205 million people of productive age in the year 2030, because Indonesia is a big country. So, however, what would follow is a challenge when the population is aging. In 2021, the population of people above 60 years old was 10% of our total population. And it is estimated to double by the year 2050. So you can imagine what we need to do right now. So this will expose us to a heavy financial and healthcare burden. So it is crucial for Indonesia to focus on investing in healthcare infrastructure and professional health workers to treat major illnesses such as heart disease, stroke, cancer, and uronephrology as the leading cause of deaths in our populations. Growing old is inevitable, but aging is optional. So to address such growing burdens to our lives and economy, Indonesia has embarked upon an ambitious health system transformation that largely focuses on primary health, promoting healthy lifestyle, expanding immunization, mandatory screening, and improving quality and access to primary health care are central to our effort to increase life expectancy. Furthermore, nowadays, the science of aging has also advanced rapidly. So we need to do that. So now, Ministry of Health is committed to carrying out health system transformation. We call it 6 pillars of transformation that support the Indonesian health system. The first pillar, we call it primary care transformation. So we need to improve the population education, primary prevention, secondary prevention, and increasing primary care capacity and capability to make people healthier. The second pillar is the referral services transformation. So we need to improving access and quality of secondary and tertiary services, especially because Indonesia is a huge country, so we need to make sure that everybody have the access to the tertiary services. The third pillar, we call it health resilience system transformation. So we need to increasing the resilience of the pharmaceutical and medical device sectors and strengthening emergency response resilience. Because our experience, the COVID-19 teaches us that we need to have resilience of our product, especially in the domestic product. When the pandemic happened, every country locked down the country, so we cannot do everything. Thanks for happy to have us. And the fourth pillar is about the transformation of the health financing system. We need to have a regulation on health financing with 3 objectives. First is available, sufficient, and sustainable. Second is fair allocation. And third is effective and efficient utilization. So this is under the universal health coverage. The fifth pillar is transformation of health human resources. So we need to increasing the number of health workers equal distribution of health workers, because we are a very huge country, has many islands in that, so the distribution is very important. And the third is improving the quality of health workers. So we open the scholarship to the doctor to go to outside to learn more about the medical and everything. The sixth pillar is health technology transformation. So we need the development and utilization of technology, digitalization, and the more important thing is biotechnology in the health sector, like you mentioned. Digital, the technology and biotechnology. And because in the future, we are not the pharmaceutical anymore, but we're moving to biotechnology. Thank you, Reddy.
Wow. Well, I mean, I think that Hoon is very happy. I tell you why. Because the bank is going and moving to create like our first health strategy, right? We are starting to do that. So I think that you just wrote a very good health strategy. Yeah, exactly. So if you can actually share your PPTs, then we can definitely leverage on that. Oh. No, but but I think, you know, a couple of things, right? And I think that set up also for the follow-up questions, right? Marianne, shall we start with you? Right, the Secretary General actually made a couple of things that are very important, right? Like, in particular, pharmaceutical, the sort of the, you know, capacity to avoid what happened during COVID, right? Immunization, right? Health, you know, health system workers, also digital. So can you actually, I would love your thoughts on that. And then Calypso, you're on deck to work on basically the sort of the health financing system, right? And also obviously financial innovation, because I know you're thinking on that.
Thank you, and thank you. It's such a pleasure to be here, and thank you, Rodrigo and the AIIB. I actually think that having this type of forum is very important, because the issues that the Secretary General talked about actually are not just health issues, but they are really, you know, cross-cutting issues. And having a forum like this one and the membership that you have is actually very important. So I'm pleased to hear that you are going to have a health strategy, but it has to be broader, because you actually have the ecosystem for this. No, I think, look, it's clear that what the pandemic taught us is that we have to build further the routine immunization system, as you were just mentioning, and that is really going to is our focus right now. At the same time, I just want really to commend a lot of the countries here, in particular Indonesia, because this health system that has been built over time with all our support has allowed to distribute 3 times more vaccine in a year than usual. So I know we point to it, we are very perfectionist, but we have to acknowledge what he has done. It is 3 times more vaccines, you know? So it's incredible. But indeed, you know, we need to do more because we have seen some backsliding. Luckily, thanks to Indonesia, we just had the what we call the WUNIC survey, that is the coverage of routine immunization, is back to pre-pandemic level, thanks to Indonesia mainly, so to a few countries, but it's diverse. So we do have to tackle the pockets, because averages are averages and they hide a lot of things. So more needs to be done there. Also because, of course, we talk a lot about COVID-19, but it hid other epidemics that came after that. We have the highest, you know, Gavi actually manages indeed, is focusing on children immunization, as you mentioned, but we also have pandemic preparedness and response at the core of our mandate. We manage the global stockpile of vaccines, so if there's an epidemic in a country, we are the ones sending immediately the stockpile, and we have the 4 times the number that we have ever had, you know, for yellow fever, cholera, I mean, and again, this also is exacerbated by the climate change, you know, so climate extreme weather, we have seen that in Pakistan and other places. So we do need indeed to have even stronger health systems and surveillance. So that's one thing. The other thing indeed is really focusing on building supply resilience. We heard the hard way during the pandemic that we have fostered all these years a global vaccine supply, which is great in bringing affordable vaccines at the lowest possible price. At the same time, there is the need for supply resilience. So that's why we are really working closely with the region, with Indonesia, of course, ASEAN. I was there at the summit a couple of weeks ago, and Latin America, Brazil. Really to have, to focus on regional manufacturing and to help think about instruments, given that Gavi indeed has a long history of financial innovation, to help build this regional resilience with instruments that allow over time to reach the competitiveness while at the same time having supply security. And I'll be happy to talk more about it. So that's really our focus. And of course, because the Africa region was so badly affected, one of our first efforts is really to launch a vaccine manufacturing accelerator for the Africa region, but also, of course, working with the other regions to accelerate the effort there. Finally, I think an important thing we learn also, and that is going to be important not just for the pandemic, is that there's a need to have search financing. There was mention about finance. What we learned during the pandemic is not just about having finance, but having it very quickly. What we call the day zero. Having it the first day, because actually what all the evaluation of the pandemic showed is that if we had had the funding at day zero, probably 70% of the impact, of the disastrous impact, will have been avoided. And there, of course, Indonesia, with G20 presidency, needs to be commended, and we work closely with Minister Budi to, of course, for the development of the instrument and the pandemic fund. So having this search financing will be critical, and we'll be very pleased to talk about it further. So I'll stop there.
Great, thank you. And I will add to that, Marianne, that is having the right type of financing fast, right? Because we didn't have, there was a lot of money, but it was useless because the type of money that you needed was not what it was available. And in particular, we needed de-risking financing for R&D that it wasn't, right? It took us 9 months to get $1 billion, miserable $1 billion in that thing, and actually to get that going, right? So that's actually a shameful thing that sometimes someone will need to actually write the COVID diaries about that. But just, moving on more, like Calypso, you actually started, the basically innovative financing, right? Like a lot of your work looks at the health financing and the issues and also try to push actually the envelope on that. So the Secretary General mentioned that as one of the key things, but also from that, but also, you cover much more ground also. It would be great to get your sense of the main gaps. And Albo, you are on deck, right, for the issues that also have to do with all health strengthening, right? And how you're actually working on the AIIB on that.
Thank you, and thanks very much for having us here. So if I may, Rodrigo, just step back for a minute and look back to the 90s when there was about $7 billion invested in global health interventions, and 30 years on now, we've had a tenfold increase. We're looking at about 67, 68 billion invested, but the way these resources are invested is very different, right? So back then we had the bilaterals, multilaterals. Now we mentioned the Gates Foundation in the early 2000s, Gavi, the Global Fund. So different conduits through which the resources are invested. I think that's quite important. And what we're also looking at, I was quite surprised, I was looking on the plane over the IBRD net transfers for 2022 were just short of 15 billion. So that doesn't sound like a lot of money to me. In fact, across all MDBs, gross disbursements in relation to the GDP of the borrowing countries have halved between 1990 and today. So the balance the amount of money, but also how these resources are being spent has changed. And of course, I mentioned Gavin, the Global Fund, and there's some discussion, a lot of discussion, in fact, nowadays about the so-called verticalization and perhaps less of an emphasis on systems. And I want to take a moment to challenge this a little bit. These vertical funds are disease-specific, they're technology-specific. When they were set up for a purpose, and they've served that purpose quite well. In the context of the Global Fund, for instance, we've made huge progress in addressing TB, HIV, and malaria, and in doing so, we've been a major driver for reducing inequalities between countries, especially the poorest countries, especially in sub-Saharan Africa, with the greatest burden. We've seen massive gains in life expectancy. So I think it's important to acknowledge that. And increasingly now we're investing in health systems, and as Marianne mentioned, we're looking at supporting primary health care. And in fact, with the government of Indonesia and the World Bank, we're doing some great work with Body, looking at supporting BPJS, specifically on TB, looking at the referral system, digitization, etc. So I think there's huge potential in coming together and working together. And since you mentioned financial innovation, I think what a big question perhaps for us to reflect on is exactly how all the different institutions and different conduits that exist work together. I think we need to move away from the dollar in, dollar out approach. The whole needs to be more than the sum of its parts. So how do we make this happen? And what lessons can we take, perhaps even from climate funds? Good and bad lessons. I'm not saying that there we have perfect success, right? But it's a bit horses for courses. So what type of funding do we need? If we look at to our climate colleagues, they talk about grant funding, for instance, for loss and damage. Okay. Fine. When we talk about adaptation, we talk about concessional funding, long maturities, quite highly concessional. When we look at mitigation, transformation, private, if we transpose this over to the health sector, what does that look like? How can we use the grant money together with concessional lending, together with the private sector investment? I appreciate this is different in health, of course, to do more, because as we all know really well, rather well, there's not a lot of new money to be found, so we need to build on that. But so I'm hoping we can have this conversation as we, today and to be continued, of course. Thank you.
Fantastic. We will solve that now, yeah. So, thank you so much, and I will pick up that in the second round, but I totally agree with that. I mean, I think that there is a need, and also this is also related to what happened in COVID. We need to be very clear before these things actually happen, what money will be ready for what, right? And I think, again, I have my own thing that I will, reserve in terms of the NDB action there. But, Aubo, so obviously a lot of this has to do also with not only finance and money, but also capacity, right? And also regulation and all that. And so we would love to get your views also, right, from a more like AIIB perspective of how you are tackling this. But again, what are the key gaps that you see from your vantage point?
Thank you, Rodrigo. I think that, we all agree that nothing is more constant than change. And this change basically is a major contributing factor to the health system and the health system infrastructure that needs to react to the changing environment. We saw that example in the COVID, as has been discussed in this panel. We were not ready. We didn't have the vaccines, we didn't have the medicines, we didn't have the diagnostics, we didn't have the ventilators, etc., etc. All of that is behind us now, but we all know that the next pandemic is just around the corner, waiting for us. We don't know when it's come. Are we any better prepared for that event? Unfortunately, I'm a little bit negative on my personal experience, and I think that we could be more agile, we could be more ready to adapt, especially in the context of climate change. Because like WHO has stated that climate change is the single biggest threat to facing humanity. That's a very bold statement. And now we are thinking, okay, what are we doing about it? How we are preparing ourselves? Do we have the instruments at our disposal? Money is, of course, one thing, but then we need to have the people who are capable of implementing those projects in order to tackle those proactively rather than reactively. And that's where we must urgently to take steps to look into what could be done in anticipation of climate-related matters that will be facing us in the future. We need to keep in mind that health security is an essential economic pillar of equitable society. If health is not in order, there will be a lot of disruptions in other fields of life as well, civil unrest, etc., etc. And we have learned something, not everything, but we have learned something in the Western society that we could be then translating and applying our knowledge to the less developed LMICs. And therefore, I think we have a legal and moral obligation to kind of transfer that knowledge in order to address the issues up front.
I 100% agree with that. And again, I mean, I remember when we were doing things, I think on malaria, right? And the appealing of, I remember the former president of the Inter-American Development Bank, Moreno, appealing to the Ministry of Finance, say, I want to tell you how much people don't show up to work because of this, right? And then after that, they say, well, we are going to actually invest on this. Because when you put things on perspective, right, what I think still strikes me is that in COVID, putting this in perspective, how much money would have costed to do that early. It just, anyway. So now moving into positive things, right? Like a starlight moving shift that we want to see. I think, you know, and also I would love also, Secretary, to start with you, because it would be great from your end. It's like, what are the shifts that you would like to see, right, from the country perspective, right, in the architecture? What are the things that shifts that you want? You want, you know, things that actually they are doing more of, the things that you should be that do more of, the things that we should be less of, right? From your perspective. And also, I would love you to bring, Indonesia is a very important case because also it's not a low-income country, right? And right now there's a lot of that conversation, and Calypso mentioned to that about concessionality, right? And there's this conversation about, well, that old paradigm of putting concessionality only in low-income countries is not going to cut it because we need to evolve that. And one of the major breakthroughs in this is, for example, in the G20, is the first time that I see that they say we need to move the concessionality framework forward, right, including for middle-income countries. So I would love also your thoughts, right, about that in terms of the shift that you expect, you know, these institutions, you know, to do in support of your strategy. Easy.
Okay, thank you. Yeah, before I answer your question, we need to have the same goal. Yeah. The goal is we want to have a high life expectancy. Yeah. So we need to improve our health care and need to change our mindset from curative to promotive preventive because it's more efficient and effective. Yeah. And thanks a lot to all the donors stay here, Coffee, Global Fund, AIIB, is always support Indonesia to improve our quality of healthcare. And like Calypso said, since 2014, Indonesia introduced the health insurance. We call it the National Health Insurance Scheme. Yeah. And this is make significant progress to achieve the universal health coverage. So the aim of the universal health coverage is to provide all citizens with access to adequate health care and financial protection against catastrophic health expenses. And right until now, the JKN, or the Universal Health Coverage, our program, it already covers around 257 million people and represent approximately 93% of our population. Yeah. So while national health insurance addresses the demand side of universal health coverage, the supply side remains unattainable. So without sufficient healthcare professionals and adequate infrastructure, we cannot, so if right now, like in Indonesia, everybody pay the insurance, but when they go to the hospital or the the puskesmas or clinic, they cannot have a good quality of services because lack of like infrastructure. So based on that, yeah, so we think to serve the entire Indonesian population, yeah, we are around 270 million people and over 6,000 inhabited islands. We need to have at least 300,000 points of healthcare. Yeah. The closest equivalent to this number is 301,000 primary healthcare posts, or we call it posyandu. This is very in the low level of government that are available across Indonesia. So it was initiated 50 years ago as a forefront of improving maternal and child health in the community. However, until now, 40% of posyandu is considered not active, and also there is still lack of availability of equipment needed for services at puskesmas. Puskesmas is higher than posyandu. We have a 10,000 puskesmas. That the lack of availability equipment is like action or emergency set, general and maternal child health equipment set, dental and oral set, laboratory set, and everything. Immunization set, of course, and e-patient set. Actually, I'm an economist, so I need to learn about this kind of set. On the other hand, some referral hospitals, especially for catastrophic diseases such as cancer, heart disease, stroke, and uronephrology, also lack the necessary infrastructure, medical equipment, and skilled healthcare professionals to provide high quality care. This can lead to overcrowding, long wait times, and inadequate treatment, of course. So under the health transformation agenda that I mentioned before, Indonesia would like to revitalize this primary healthcare posts and increase the access and the quality of referral hospitals. The objective is to ensure that all populations, including the underserved and or in hard-to-reach areas, can be served. So this could only be done through partnership, but this could only be done through partnership. Yeah, of course, yeah, like we mentioned that, like now in Indonesia, it's changing from usually we have a technical assistant, everything. We move to more physical equipment that I mentioned because we need to distribute it all the service, health services and the primary care in all Indonesia. Yeah. So right now we all still discussing, even though still discussing, that the Ministry of Health has recently concluded negotiation of about 4.2 billion multilateral loan from World Bank, ADB, ISDB, and AIIB. That substantial funding will be used to revitalize 300,000 posyandu, 10,000 puskesmas, and 514 city-level public health laboratories. So we have a posyandu, puskesmas, and laboratories. And part of the loan, we will also upgrade and modernizing hospitals in 514 cities and in 34 provinces with essential facilities to support the detection of cancer, heart disease, stroke, uronephrology, and maternal and child health, such as CT scan, MRI, mammogram, and etc., CAT lab, and everything. And through partnership with multilateral development banks, Indonesia will be able to accelerate the provision of that infrastructure rather than just using the government's budget. So we can accelerate this. Yeah. But not only in this, in addition to the fulfillment of facilities and infrastructure, the Ministry of Health also aggressively carries out preventive promotive effort by collaborating with the private sector to several activities, such as like COVID-19 vaccination. Ministry of Health partnered with thousands of private institutions, with NGOs, military, and police to roll out COVID vaccination nationwide. Like before, we cannot imagine that we can achieve what we do like now. Yeah. We are right now already vaccinate 550 doses vaccination to everybody in Indonesia. This is a huge achievement thanks to Wakafi, especially in the vaccine. Okay. And for HIV and TB, we need to partnership with NGOs to reach key population and increase access to screening and treatment support. And we still have a problem with stunting, yeah, for stunting prevention. We already partnership with donors and NGO to promote education program to help people learn more about healthy child growth. Because the stunting is our future generation. Yeah, if we didn't concern with the stunting, our future generation is not very good. So we need to help with the donors to make everybody know about how to do the nutrition and everything to the babies. And the last, the remote areas, borders and islands, we need a partnership with NGOs to provide care to those living in remote islands through floating hospitals. Yeah. We have example from the Dr. Ser and Satria Ailangga, and those living in forest area, for example, with Yayasan Asri and many others that we cannot mention in here. So based on what I mentioned before, it means that the important thing is how we achieve the higher life expectancy with more effective and efficient budget. And with help with donors and everything, it's moving from curative to be promotive preventive to make people more healthier, more productive, but with more effective, efficient budget. Of course, because I'm econom, so I'm the Tikas econom. Thanks.
Thank you so much. And I think, again, I think that's why the partnership is so important, because health has a lot of recurring expenditures and capital expenditures, right? So that partnership between the government and the financiers, right, needs to work out. Otherwise, no, and Gabby knows that very well, right, on the things and how to sustain these programs and everything. But for doing that and do the catching up, we will need a lot of capital expenditures and also capacity building, right? So, Marianne, will be great. I mean, you hinted a little bit in your first answer, right? The things that you're doing differently, right? Things that Gabby has been thinking very, like learning also from the tough experience, right? So what are the things that you're doing differently? And also, if you have like the type of innovations, and also if you can tap on the partnership, right? How you see the partnership in that sort of new way of doing business, that would be great.
No, and I think listening to the Secretary General, one of the first things actually that we are really moving forward is really the partnership with the private sector. 6 years ago, actually, we started a partnership with a drone delivery company to deliver actually first blood. It was the partnership was in Rwanda because it was needed for mothers that were about to have baby, and then extended to vaccines. And at the time when we started it, people said, "Really, drone delivery over there? Are you sure?" Look. Today, luckily we did it before COVID, because today in 8 countries, and Ghana is one of them, I know Ghana is here, we were able to deliver 24/7 vaccines in these countries, and it's costing us 50% of the cost of the normal delivery system. And actually doing this, we were able also to tackle the zero-dose children. And actually, in the countries where we mainstream that delivery, we actually didn't have any backsliding of routine immunization. So it's so powerful. And in a sense, and actually when I was in Indonesia recently at the ASEAN, I discussed this with Minister Budi, and this is the type of thing that will be so useful. So to your point, with the same level of financing, we are able to reach so much more. And this is actually done. So how did we do it? As you know, we have also an instrument called the Gavi Matching Fund that has been incorporated, capitalized with the Gates Foundation, several sovereign donors, to encourage private sector investment. And we co-invest actually with the companies to develop first a concept, a proof of concept. And so then, in a sense, we finance the capital expenditure, but the service delivery then is financed at the lowest cost by the government. So if you meet the president of Ghana, he loves it because now it's whole. It went to the parliament. They all love it. It's now being rolled out in Nigeria, in the biggest, states where you have a lot of zero-dose children. So this is the type of thing that is very, very important to help actually improve. So when you were talking earlier, Rodrigo, about the challenge of digital, of technology, it's actually an opportunity, especially in the countries we work in, because it's so much faster to roll out technology. A similar example, we rolled out in Bangladesh and now again in Ghana, a biometric system that we worked on with a technology pioneer associated with NEC, and we tested it in Bangladesh because one of the key issues, what is it in health, is being able to identify, track, and monitor. So this biometric that was developed actually for children, because children is very difficult to fingerprint, so it was adapted for 9 months, so it was never done. And now, it allows you to basically follow these children much more easily at the lowest possible cost, especially in countries where people move. So this is the type of thing where we have an incubator called Infuse in Gavi that we really want to push forward because it's about so much more efficiency, so much faster, and better. So this is one of them. Of course, we have been, and the good thing is that in financial innovation, when we have been persistent, it has worked. And I think that's why I will call on all the financiers here to come together with us, in a sense, to tackling this. One, of course, of our flagship innovation has been IFIM, as you know, the vaccine bond facility. And IFIM has been fantastic because it has been a groundbreaking mechanism where, we have donors giving 20 or 25-year pledges, but we go immediately to the capital market and you use the money to save people now. It was very instrumental when we developed the Ebola vaccines, that is 95% efficacious. It's been tremendous at the beginning of the COVID-19 for R&D. It allows us to support our sister organization, CEPI. And so we need much more of this. We have raised 8 billion with IFIM, but we can do much more. And hopefully we can find a mechanism, and I challenge you now, where regional banks can work with us and invest in IFIM. But I think to the last point we talked about, what's really needed today is this day zero financing facility. And it's actually having various facilities, one that is a first response one, so that if something happens tomorrow, we are ready to invest in a new product, in R&D, at risk. And it's not about putting billions, it's putting enough so that it can allow us to be at the forefront and tackling and avoiding what we have, while we, of course, use the other instrument, IFIM, the advanced market commitments, working on developing regional capacity. But all these need to come together, and I think that's where we need, and in a sense, the flexibility, the agility of banks like AIIB, EIB, with whom we partnered, and where they were one of the first one to put a front-loading facility. But I think that, coupled with some of the other things, will be very important. The last thing I would want to say, though, I think we have to be clear, this is one piece indeed. Financing is one piece of the puzzle. We need more countries like Indonesia, like Egypt, with whom we have worked very well during the pandemic, to work on the demand side, making sure that, the demand generation is there, that countries trust that we work on tools, and there's a lot of digital tools there to be done. We still need to finance the factories, so we also need you. Because we will work on pooling the supply, but we need to finance the factories. We can be the off-taker by guaranteeing, and that's the point. But this is, and of course the regulation. We didn't talk about it, but having much, much faster regulation. It cannot be that one country certifies a vaccine and it takes 9 months for another one to have access to it because we are waiting on the capabilities. I'll stop there.
Wow, that was amazing. I think, so much. And again, I seen people there that actually work in IFIM, right the very first time. So that Edge is there, is for you. So we need another idea from Edge there on what will happen. But a lot of history I can see in the room. Anyway, so that's great, and that's why I think it works to partner, right? Because there's no way we and the AIIB, for example, we are going to ever replicate the expertise that Gabby has doing the things in market, right? And so I think the capacity that actually we can be guided by where our money will be more additional, I mean, actually is that. So with that, I think, Calypso, it will be also great from you, right? I mean, the Global Fund has always in the forefront also innovating, trying to do new things, and also fighting that capacity of how you stay focused, right, also. So what are the things that you see, right, how you're changing, but also the innovations and also the partnership that how can help us to actually move this forward?
Right, well, partnerships matter. So what are we doing? As you said, Rodrigo, the Global Fund has been working closely with partners, including MDBs, and we're currently working to streamline our processes to make sure that as opportunities arise, where there's political will, as we're seeing in the case of Indonesia, for instance, we're ready to work together, and we would love to work more closely with you, understand each other's processes, and reduce the bureaucracy, if you like, when it comes to approving those deals. So we're very much committed to that, and we look forward to working with you to make it happen. I think to what Marianne mentioned, health financing money is only part of the problem, of the need, one ingredient. I think global health leadership is important. We've had Bridgetown and the Motley Macron Summit in the summer. Obviously, some of you were at the UN meetings. It's wonderful to see the AU be part now of G20. That's fantastic, and to see how this plays out and what actually means. But I think if we can work together to articulate a more coherent proposition when it comes to health, all the way from infrastructure to human capital to digital technology to technical expertise. So we're all buying into this, following country leadership. Because as the DG mentioned, Indonesia is perhaps an exception. We're seeing many countries, at least anecdotally, are in fact deprioritizing spending on health after COVID, which may sound paradoxical, but there's some explanation for it perhaps. So what are these nuanced financial incentives, whether it's concessionary lending, whether it's debt restructuring or debt forgiveness, earmarked donor funds, co-financing conditionalities, public-private partnerships? What are the incentives that can drive investment in health that's coherent? So we need this broader accountability framework for this to work at the country level, and I think that's where there's a lot we can do to work together. But yeah, I think for me, what is quite important is to find some specific examples where we can do stuff together and learn from that and scale and generalize. I think viewing grants also as a source of routine source of concessionality. You mentioned middle-income countries. Combining our forces, our deep technical expertise in the issue, the issues of infectious disease, TB, HIV, malaria, but also health systems strengthening to prepare for the next pandemic, or indeed to respond, as we've shown with our C19 response mechanism. But then also the Global Fund's ability to engage at community level. That's incredibly valuable. These networks at country level, Pak Kunta mentioned NGOs to address the needs of key populations. And we have that, and we want to work with you to really capitalize on that. I think that's quite important. As you say, we don't need to duplicate, we need to complement each other. Thank you.
Excellent, yeah, and obviously totally agree with that. I think, you shouldn't never underestimate the trust that the countries have in the Global Fund, right? And that's also another thing that we're never going to be able to replicate, not less because the bank, the AIIB in particular, doesn't have like country office approach, but again, I mean, the capacity to actually reach out to the community. A lot of actually has to do with social norm change, not just financing, right? So for the money to actually work, people need to actually like trust the vaccines, right? So just to put and to do that, you need people to talk to people, right? And that we're going to be never to do that, right? To an NDB, I don't think they want to talk. But I think that, you know, in things like the Global Fund. Also, the Global Fund has been also a trailblazer on things like debt for health, right? In another context, different things, right? But actually, you have been doing this for a while, and now that actually is that sort of debate on whether we scale it up or not. I think that's also an important one. So again, I mean, and we're very much looking forward again to exploit those leverages.
And if there's a source of liquidity or a willingness for political risk insurance,
yes.
and we're very open to
yes,
discussing
exactly.
it.
Well, we're getting there. We're getting there. But again, I mean, I step is on the policy. So, Albo, I have to say one of the great NDBs, if almost the only one. At the beginning of, you know, of COVID, EIB was there, right? I mean, you actually were there, bridging money, right? You know, we were, so you really can speak with good, you know, grounds. It would be great, like, building on that, right? I mean, it was a lot of liquidity, right, that we needed at that time, and actually back liquidity, like back financing by the EU and all that, and you were there. So I would love to hear from you how you're thinking, what are the evolutions in your thinking, and also how you're thinking about partnerships, right, and making it forward.
Yeah, I think the key here was actually the partnerships that had been already nurtured in advance. We had a partnership with Gavi, for instance, that we were able to kind of utilize at the time when COVID unexpectedly hit us. And then, you know, we had already agreed certain parameters upon which we could build on this financing package under Team Europe initiative, where the member states, you know, committed a lot of money. We could then manage internally, sometimes even bypassing our existing procedures in the point of, you know, urgency. For instance, the 50% maximum lending limit that we usually have, we could go up to 90% depending on some of the countries. So we exercised a lot of flexibility that was somewhat unusual for the EIB. But I would say that this was basically, you know, only possible because we had already discussed with the implementing partner who knew the vaccines inside out, who knew how to do it, you know, if they only had the financial means, and that's what we brought into the picture. Little bit same story that we had also with the Gates Foundation on the AHDP, the African Health Diagnostic Platform, that we had started to talk about, you know, how do we engage the regional governments to take charge of their capacity on the healthcare. We know that the knowledge lies in the private sector, but private sector is hesitant on making long-term investment unless they are somewhat guaranteed that they will get their return at certain time. And that's where this instrument was developed together with the Gates Foundation. And we were able to kind of get the governments to buy into strengthening their diagnostic capacity on infectious diseases. And all of a sudden, of course, COVID-19 testing was there to be demonstrated that, you know, actually you have this disease and therefore you need to address that from the public health point of view. So those are two key examples of how nurturing partnerships and collaboration develops and deploys suitable financial solutions to catalyze greater sector engagement and capital to strengthen health security and resilience. I think that's the main lesson to be learned. And at this very moment, I think there was in June 23 a signature event between WHO, public healthcare on health impact investment platform, where many MDBs, including AIIB, EIB, have been invited to participate. It's a 1.5 billion euro facility that is basically aiming to bridge the gap between health system investment needs and limited domestic financing. And I think, you know, having this sort of instruments available at the time when the next big thing hits, you know, is the way to go.
Marianne was saying, I don't think that we figured it out yet, right? I think that if we have another hit now, probably we are going to be in a very similar situation, and that's actually worrisome. how are we doing on time? I mean, I can speak like the whole day about these things, right? So I need someone to actually limit the time. How are we doing? We have 10 minutes. So I can give you some time now. No, so we can open. Can we open the floor for some questions from the audience? I think that would be good, right? All right, so let's do that. Let's see if someone has questions for the panel, and then we will give it to probably 1 minute, like ending for each of the panelists, and then to whom. Okay? Any questions? Yes.
Well, thank you very much. Fantastic presentations. Thanks to the presenters and to AIIB. 4 perspectives, rich and diverse. I have a strategy question that from your vantage point, where do you see the best value for money or investment from your perspective? So within Gavi, Government of Indonesia, is it primary healthcare? Is it secondary healthcare? A global fund? What would that be?
No, I mean, clearly the primary health care has to be the foundation, because as I explained, from there then you can dial up or down with some of these extreme events, whether it's a climate event, where it's another pandemic. So you really need to have a solid primary health care. And of course there, you know, vaccine in a sense is the most widely used intervention, right? It reached 90% of people, and a mother will always bring her child to the clinic and then be tested herself for various things. So the primary health care has to be the starting point, and building from there, because it's from there that you will be able, in a crisis or in an extreme weather situation, to be able to dial up. Now the other thing is, of course, to have also this always, we need to have always search capacity on. Why we were surprised in the COVID, there was no search capacity. So first we had to scramble and then come together and then, you know, bring various organizations. It was great, people did their best, but now one of the lessons is really to have always some kind of search capacity. That is part of what's being discussed, of course, with the UN, with the network of networks, with the INB, but extremely important. And in a sense, like we have in banking, I always say it's good always to have a kind of a lead arranger, knowing that if, you know, I mean, if there's a problem in vaccine, okay, we turn to Gavi, we organize with partners. If there's a problem in, you know, in other things, it would be the Global Fund or in others, you know, just to signal so that we avoid looking at each other. I think, you know, when something happens, who goes first? Who should do this? We lose so much time, you know? So I think that's another part that is quite important, having these pre-agreed roles and working. I just want to come back, since I have the floor, to what Calypso also said. I think the value of the partnership, and I think it's great that AIIB is really looking at this, is thinking also the partnership at 3 levels. At the global level, because some of these issues you really need to think globally, because they are global public goods. But we also need to discuss regionally. That's why I think one of the fantastic also benefits of the pandemic, if I may say it like that, is the you know, this recognition by the regions, you know, and all regions. You know, the EU decided that, hey, health was actually a regional matter. Before it was not, you know, being looked at. They created Team Europe. ASEAN is really coming together. The AU came together, and the other regions. So think globally, discuss regionally, but act locally. And I think that's what you have to think. Okay?
I just add some what we already discussed before, yeah, like from Gavi, Global Fund, and Bartofo, and Indonesia, that like you mentioned that, like I mentioned that we are change our mindset from curative to promotive preventive. So this is the one way how we can make our goal achieve as in an effective way, because we want to people more healthier using the promotive preventive. Not only in Puskesmas, but also in the laboratorium is very important, like we mentioned, because we need to have what is called screening and surveillance to make sure that what is the disease that's happening in Indonesia and something like that. And actually, we want to have something like the financial support to incentivize the innovation, because it's very important for us to make our system, the health system, resilient and pandemic preparedness, of course. Yeah. So this include funding, like we already discussed about the research and development and the new technologies, vaccines, of course, because we have the mRNA and everything, and the treatments, as well as investment in healthcare infrastructure, because it's very important. Yeah. Especially in the high technology, because in the development country, developing country, it's very hard to have new technology. And we hope that we have the support for the establishment of something like a global network and forums where countries and development partners can share their experiences and best practices. Because sometimes in Indonesia, we have a lot of diseases in there. Obviously, what is tropical disease, but sometimes the medicine and everything, they didn't have a lot of research and development in the tropical disease. So we need to have some forum and something like a network to discuss and to share each others. Yeah, this is what we did thinking to make sure that if we have, I don't know, maybe in the next pandemic we can more prepare and more know what is the pandemic happen again. This is, I think, from me about this, how to make that. Yeah.
But I think this is actually your final comment, so you have to use it well. Yeah.
Thank you very much. Well, I guess you've said it all on value. I guess value lies in the eye of the beholder. So I totally agree with Marianne on the importance of context. So countries decide what is good value for them. Now, to be able to decide that, again, it takes a lot of effort to build capacity to be able to have these processes run and the evidence to inform this kind of process. So I think that's also an area to invest in. But what I would say is, my final word, sentence, is that, and it became apparent also from what Pak Kunta said and Marianne, investment in primary healthcare is important. Investment in human capacity, human capital is important. And then when you think about infrastructure, think about digital infrastructure, think about both extremes. Warehouses, for instance, for central medical facilities are very important, but at the other end, digital payments seem to be taking off throughout less wealthy economies, poor economies. So how can we combine this? I think that's where the innovation and the imaginative thinking needs to come in. Thank you.
You're putting a lot of things in this, like what is the best thing. But I guess the summary is that...
It's the short list, the long list.
No one thing, but actually, again,
Okay, I think that our duty as one of the main MDBs is to establish effective financing arrangements that provide capital for the development of high-impact, equitable, people-centered primary healthcare services. And this is where I started, actually, this afternoon, and this is where I want to end. Of course, we need to get the buy-in of the governments, because they are in charge, and they should be always in charge and respected for their role. It cannot be taken away from them. And once we get that commitment from the government, like now I would like to take the case of Indonesia, with whom we have been negotiating for quite some time on a variety of different things. Now finally, after 15 years, we were able to reach a conclusion on rehabilitation and furnishing of primary healthcare facilities for 250 million euro loan that we have just approved in July, and hopefully it will be benefiting the general population of Indonesia. And this sort of activities we would welcome very much from the countries of the region, but also globally.
Thank you so much.
Yeah, so thank you. Thank you, Rodrigo, and for your good performance in conducting very productive and insightful the panel discussion. Actually, so yeah, so I like to wrap up, and also in that sense, I like to thank each of the panelists for you have tremendous expertise and insight and experience. So we have to, we learn, and we have to work together based on what you have so far shared. And actually, I also would like to offer a couple of thoughts as a development banker, you know. So in concluding our session, number one, to me, as a development banker, the health is not just about pandemic or disease, you know, something negative, you know. Health is directly related to human capital and productivity of the whole economy. So it is very clear to us that without investment in human capital, particularly in health, developing country, very difficult to go beyond the challenges of middle income trap, you know. So from that sense, health is more positively important. And also, we see these days, I mean, the world is a better place. Like in Korea, I see around my neighbor, everybody's 90 years old. So people live longer, and people want to live better, right? And now if I go to India, if I go to Indonesia or Uzbekistan, now they all want cancer hospital. They all want equipment, all these things, you know. So again, I mean, this is a quality of life issue, health. Now, having said that, it seems like there is a consensus that next pandemic will come sooner or later, right? And everybody said we should be prepared. But one thing, the pandemic response, except AIIB, came very late and not enough, right? But now it is ironical. A pandemic is behind us. All these loans from MDBs, vaccine loans and all. Initially, we couldn't find vaccine, right? Now all this money lending, actually, frankly speaking, either we have to divert and we have to cancel it. So cancel, I'm happy. Okay, let's cancel it. Now use this vaccine loan, whatever left over, let's use it for the health system improvement. So it is good. So as mentioned, if the next pandemic comes, we need to work on global some design structure. I'm sure WHO is doing it, so that money can be mobilized quickly, ready. But I hope, I'm sure WHO is working on such a structure. Now, just related, one more point. So it was mentioned by Calypso that we can clearly see deprioritization. Particularly after pandemic, we are living in a world of 5% plus interest rate. So MDB is not in a position to lend. And that's why I think Indonesia is an exception. At a certain point, I felt, wow, Indonesian government is so brave or have a really long-term human capital perspective. Because I have another client, a very, very big country, originally planned health sector reform with all other MDBs, more than $1 billion program. We're all working together, but they decided they can only take concessional loan. So $1 billion becomes 300 million. I mean, this is not enough to reform health system. And also deprioritization happening because the government has no money, they spend too much money, and all the money diverted back to, so how this, I think it is all your, as a health expert, I think, is all challenges to you also. So with this kind of a challenge, I think we discussed, and it's time for all of us to go back to work together and to achieve our common goals and vision, and we continue to talk, but we also have to do just one request. One request, we are a bank, we can lend, you know, but what is definitely lacking is some concessional funding. Luckily, we just recently, I have a project, One Health project. It's more like animal vaccine and all this project in Cambodia. The loan we will sign tomorrow, you know. And luckily we got 20 million working together with Rodrigo from pandemic fund. So that money, grant money, will substantially increase the grant element of MDB loan. Yes, but he's doing my job now. Excellent. No, he's doing that. But the problem is, we all talk about this global facility, but now pandemic fund is great. It helps us to work, but it's too small. So I hope this is not a $300 million facility. I hope this will become $300 billion facility. Then I think I can do a lot of work. Thank you.
Excellent. Thank you so